Good morning, everyone. Thank you for being here today. I'm honored to be joined today by our Governor, Charlie Baker, Joanne Peterson, founder and executive director of Learn to Cope, and many parents that she works with, Mayor Tom Hoy of Taunton, Chief Fred Ryan of the Arlington Police Department, who serves as co-chair of the Police-Assisted Addiction and Recovery Initiative, Dr. Andrew Kolodny, co-director of opioid policy research at the Heller School at Brandeis University, and co-founder of Physicians for Responsible Opioid Prescribing. We're also joined today by Assistant Attorneys General Jillian Feiner, Eric Gold, and Sandy Alexander, who have led our office's investigation into Purdue. You know, almost a year ago today, I announced that my office was investigating the makers of prescription opioids. I made a commitment to the parents who've lost children to this epidemic and those whose lives have been forever changed by the toll of addiction. Some of them are with us today. I promised to find out what these companies knew, when they knew it, and the extent to which they misled patients into thinking that their drugs were actually safe. I promised that we would get answers about the role of the drug manufacturers and distributors in creating this crisis. Today, we have some answers. And this morning, my office filed a lawsuit in Massachusetts State Court against Purdue Pharma and its board members and executives for their role in creating and profiting from this epidemic that has killed so many. When we started this investigation, we knew a number of things. We knew these pills were addictive and deadly. We knew that people were dying here and across this country in unprecedented numbers, and many more remain trapped in dangerous cycles of addiction. We knew that families had been torn apart and communities devastated. But now we know a lot more. Through the course of our investigation, as alleged in today's complaint, we found that Purdue misled doctors, patients, and the public about the real risks of their dangerous opioids, including OxyContin. We also found that they did this with the oversight and direction of 16 current and former executives and directors named in our complaint. Their strategy was simple. The more drugs they sold, the more money they made, and the more people died. We found that Purdue engaged in a multi-billion-dollar enterprise to mislead us about their drugs. Purdue pushed prescribers to give higher doses to keep patients on drugs for longer periods of time, without regard to the very real increased risk of addiction, overdose, and death. They systematically downplayed the risks of opioids. They overstated the benefits, including saying that opioids were actually safer than ibuprofen and Tylenol. Purdue even pushed their drugs to prescribers they knew were writing illegal prescriptions or had patients dying of overdoses. And they specifically targeted vulnerable populations, like our veterans, our seniors, all with the goal of increasing their bottom line. As a result, over the last decade, more than 670 people who were prescribed Purdue's opioids in Massachusetts and received Purdue's opioids in Massachusetts died of an opioid-related overdose. 670. Thousands and thousands more struggled with cycles of overdose and addiction, all this happening while Purdue, its executives, its owners, and directors made more than $500 million. These boards that you see here list the names, the first name of every single person that we know of who has died in Massachusetts from an opioid-related overdose since 2008. Take a look at those names, all 11,169 of them. Each name is a person who would be, who should be alive today. Someone's father or mother, son, daughter, brother, sister, grandparent. a veteran who served his country abroad, a dad who was about to become a grandfather for the first time, a daughter who loved animals, a hospital worker who spent his career caring for the health of others. All of them were prescribed OxyContin for years, as many as 24 pills per day, which meant more than $500,000 in earnings for the company alone, just from these 4 victims. And it was Purdue's executives who led and directed this illegal business model, unconscionable business model, using addiction and deception to enrich a few while leaving a path of devastation and destruction in its wake. Now, not only did we name the company today, but we've also chosen to name executives and directors. Ours is the first lawsuit in the country to name those executives personally and to tell the story of how they contributed to this deadly crisis. We owe it to everyone in this room, to families across this state, to hold Purdue and its executives accountable for their role in creating this epidemic and to pay for the damage that they've caused. That's our goal today. I know there's no single lawsuit or policy that's going to heal the wounds lived and experienced by the families here today and around this state. But I want the people of Massachusetts to know that my office is committed to ending this crisis. And as you can see behind me, we've got all hands on deck. That's the way it's been from the very beginning. Alongside our partners in government, like Governor Baker and his administration, our mayors, our partners in law enforcement, we're continuing to make progress on a number of fronts. Our investigation into other opioid manufacturers and distributors is active and will continue. We're continuing to arrest and disrupt drug traffickers who are pumping pills, heroin, and fentanyl into our communities. We're working with the medical community to change the culture around the prescribing of opioids. And we're working to break down barriers to treatment to make sure that every family gets the help they need. And my office is making unprecedented investments in prevention education to stop addiction before it starts, including our $2 million partnership with the GE Foundation that has made prevention education available to every public middle school in our state. Finally, I want to say this to the families who are with me here today and the thousands more across the state who are watching, all of whom have endured and continue to live in many respects unimaginable loss and heartache and are suffering because of Purdue's actions. I want them to know that it's my view there is no company too big, no interest too powerful to be held accountable. The people, the public deserve answers. That's what this lawsuit is about. It's about ending the harm, and it's about bringing relief to families and communities devastated, exploited by the actions of this company and its executives. At this time, I want to welcome our partner, Governor Baker. I want to thank Governor Baker for his incredible leadership and partnership on this important issue, as well as members of his administration. Governor Baker.
Well, thank you very much, Attorney General Healey. Let me start by thanking the Attorney General and her team for their dogged and determined work on this issue and on this particular case. We are pleased that in many cases, the data that the Commonwealth developed through the Chapter 55 Act made it possible for the Attorney General's team to develop a far deeper and more rich engagement on the issues associated with who, what, where, and when were affected by this terrible epidemic, and especially by Purdue Pharma. Purdue Pharma started selling OxyContin in the 1990s. It didn't take very long for people to figure out that it was terribly addictive. All the signs were there. All the signs were there. It went from being a very small drug to being an enormously successful drug in a matter of a couple of years. And it wasn't long after that that many pharmacies around the country started putting up no OxyContin signs because people were continually breaking into their operations and their facilities to steal them. by the mid-2000s, there was simply no debate about whether or not these pills were causing chaos, heartache, and death across the Commonwealth and across the United States. You would think that at some point in time, the people who are at the heart of this would realize the pain and the agony that they had created and step back. They chose to do just the opposite and double down. And I can't tell you how much I appreciate the work that's been done by the Attorney General to put these people where they belong, which is in a courtroom and in a deposition and in a process that will force them to own up to the decisions they made and the wreckage they left behind. I'm quite sure that this case, particularly the data that involves the 670 individuals that the AG was able, with her staff's team and help and assistance from Secretary Sutters, Commissioner Burrell, and the folks at DPH, could tie directly to Purdue Pharma's product, will bring for the first time not just all of the faces associated with this, but the very particular and specific stories of those 670 people and the role that Purdue Pharma and the decisions that they made, the conscionable decisions, as the Attorney General put it, that they made that created this terrible human tragedy. Again, I just want to say how much I appreciate the Attorney General and her team's work in this space, and I look forward to doing whatever we can as a Commonwealth to support her efforts as this case moves forward. Thank you. And by the way, I have to go to Springfield, so I'm probably going to scoot. It's not because I'm not interested in what Joanne or the mayor or the chief or everybody else has to say about this. Thank you.
Thank you. Thank you, Governor, and thank you to Secretary Sutters and the folks at the Department of Health. It's been terrific working together, and that's what we do. That's how we build our cases. That's how we make our cases, and we bring these cases on behalf of the families, as I mentioned, and that's certainly what the governor's been all about. And at this time, I want to invite to the podium Joanne Peterson, an early founder of Learn to Cope, who's going to share a few words with us. Joanne.
Thank you, General Healey, and also all of your staff for this day and for all of the work on the investigation that you've done. I've waited probably over 15 years to see this happen. I myself was at the Purdue Pharma sentencing back in 2007 in a federal courthouse in Abingdon, Virginia. I was one of the 19 that testified, and I stood there as the executives got probation, a small fine, and a company was fined $600 million. We can't go back to that day, and we will never bring back all of those people that have lost their lives, or our families whose lives have been forever changed. Even if we see recovery, we'll still never get back those days before their crime. We'll never get them back. Our lives are much different than they were supposed to be in many, many cases. And sometimes we talk about the pebble effect with what we do at Learn to Cope with this amazing staff, the amazing amount of hundreds and thousands of volunteers we have around the state and around the country. I've met Dr. Kolodny in many occasions in Washington, around the country, advocating and fighting for those who've lost their lives because of this crime and the families that are forever changed. I myself am so grateful to Attorney General Healey, who has had this on the forefront since she came into office, and for Governor Baker for all the work they've done. We're lucky to live here in Massachusetts. There's other states that do not have the luxury of support that we get here. Just to have us here today is amazing because they care. So again, we're extremely grateful. We wish it could bring back all those that have lost their lives. My office alone is covered in obituaries, and we still get them every week. I think I have 4 on my desk right now. It's still continuous, but I believe that what Attorney General Healey is doing will hold those accountable for the greed and for not caring about the families and the people and caring about the greed first. Thank you.
Thank you, Joanne. Thank you, and thank you all that you do at Learn to Cope. At this time, I want to invite to the podium Mayor Tom Hoy from Taunton. I remember when I started out as Attorney General, one of the first places I went was to Taunton, which was experiencing, like so many communities were experiencing, a significant crisis. And I really appreciated the mayor convening a roundtable discussion, learned a lot through that conversation in the early days, and it's terrific to be able to stand with you here today as a partner. Mayor Hoy.
Thank you, Attorney General Healey, for inviting me to come here today and say a few words about what this case means to Taunton. I also want to thank you, Governor Baker, for your passion around the opioid crisis. Since day one, you've been an incredible partner. And of course, my longtime friend, Joanne Peterson, and many of the survivors from my community that have worked tirelessly for many years to address this deadly epidemic. As mayor of a city that's been hit hard by this crisis, I am proud that the Attorney General is suing Purdue Pharma, its CEO, its board of directors, on behalf of all of us. This crisis, as you can see, has a human face. It could be a cousin, it could be a friend. Mothers and fathers in Taunton and throughout Massachusetts have had to bury their children. Grandparents in our cities are raising their grandchildren because their children have overdosed or are stuck in the grasp of addiction. Many of the good people lost to this disease did absolutely nothing wrong, but they had the misfortune of getting injured at work or on the playing field, and their remedy was simply to turn to the medical field for help. For some, that help got them addicted to opiates, or worse, dead. And why? Because profits were deemed more important than people. Now the perpetrators will have a human face as well. The individuals who ran this company and made billions of dollars while people in my community got addicted, and unfortunately many died. For years, we've known from our own experience that these painkillers, OxyContin and others, were a big source of the problem. So many of our residents have been victimized, and now we know from this lawsuit the role that Purdue Pharma played in spreading this deception in marketing addiction. As a mayor in charge of a police force, in charge of a fire department, and overseeing a school system, in a public health system that has been overrun by this epidemic, I can tell you firsthand, we need accountability. We need this industry to change how it does business, and we need that change now. We need lots to happen to make our cities and to make our families whole once again. Today is a major step in the right direction, and I'm honored to be here today to represent the mayors of our state, the people of my city, and to thank Attorney General Healey for her continued advocacy and being a voice for those across the state who have seen firsthand the horrors of this crisis, and thank her and her team for bringing this case forward for all of us. Thank you.
Thank you very much, Mr. Mayor. At this time, I want to bring Chief Fred Ryan from the Arlington Police Department forward. You know, a lot of our police departments have been out there on the front lines working so hard. From day one, our office worked to try to make Narcan more available by securing an agreement with the company to lower the cost. And we've been working so closely with terrific men and women in local police departments all across the state who are doing more than the job ever was really required to do. And Chief Ryan has led a force that is doing a lot of innovative work to intercede, to try to help families, to try to help them get into treatment programs, and basically, you know, treat this as the public health crisis that it is. So it's an honor to be able to stand with Chief Fred Ryan today.
Thank you, General Healey. And I want to really thank the AG's office under the leadership of General Healey and the work that they've done in this case. I know that it's been tireless work and hours of work to build this case and to bring this lawsuit, and I'm proud to stand here with Attorney General Healey and her staff today. I want to thank the governor and his staff, Secretary Sutters, Secretary Bennett. They've been extraordinary partners to municipal law enforcement over the past few years in this crisis, And we are in a good place here in the Commonwealth of Massachusetts, largely due to the leadership of Attorney General Healey and Governor Baker. And certainly want to thank my friends from Learn to Cope, and their partnership has been simply extraordinary. I serve as the co-chair of the Police Assisted Addiction Recovery Initiative. And who would have thought at the beginning of this crisis that the access to treatment for those suffering from substance disorder would have been through the lobby of a police station? But I'm here to tell you today that's precisely where it's occurring, in the Commonwealth of Massachusetts and throughout America. PARI, the Police Assisted Addiction Recovery Initiative, has over 400 partner agencies across America in 2/3 of our states. I and Joanne and others have been as far away as the Pacific Northwest and Port Angeles, Washington, to the Pacific Southwest, Florida, and other states that are grappling with this crisis and trying to help our peers, and we're happy to do so. But while the executives of companies like Purdue Pharma are banking millions of dollars, our law enforcement executives are partnering with their communities to stand up nonprofits like PARI to assist those suffering from substance disorder. Now think about that. Purdue executives making billions, and cops and their partners raising money to try to help people to get into treatment, scrape together the dollars, and come to the Attorney General's office for help in getting Narcan in the hands of our first responders. In many ways, we've chosen in the past, and one reason why we've lost the war on drugs, we've chosen one battlefield, and that's the streets of our Commonwealth, the streets of America. Well, through the leadership of Attorney General Healey, there's a new battlefield, and that's in the boardrooms of these corporations that are profiting on the backs of people suffering from substance disorder. I want to thank the Attorney General again and her staff for partnering with municipal law enforcement, and on behalf of all the chiefs in the Commonwealth, General Healey, thank you, and we look forward to our continued fruitful partnership. Thank you very much.
Thanks, Chief, and many thanks to you and your colleagues all across the state. And finally, I want to bring to the podium Dr. Andrew Kolodny, who is co-director of the Opioid Policy Research Center at the Heller School at Brandeis, and a national expert on this issue. He's been a go-to guide for this office from the beginning. Dr. Kolodny.
The reason that the United States is experiencing record high levels of opioid overdose deaths, and the reason that we're seeing heroin and fentanyl flood into communities across Massachusetts, and the reason we're seeing a soaring increase in infants born opioid dependent, children entering into the foster care system, impact on the workforce. The driver behind all of these health and social problems has been a very sharp increase in the prevalence, the number of people suffering from the condition of opioid addiction. And the reason we're experiencing this epidemic of opioid addiction has been made perfectly clear by the CDC. The CDC has shown that as the culture of opioid prescribing changed, as prescribing of opioids became much more aggressive, that as the prescribing went up, rates of addiction and overdose deaths went up right along with the increase in prescribing. And the reason that doctors changed the way that we were prescribing opioids, the reason we began to prescribe more aggressively, is that we were responding to a multifaceted, brilliant marketing campaign led by Purdue Pharma. It was a campaign that misinformed, that deceived the medical community. We began hearing that opioids are safe and effective to be used long-term for chronic common conditions. We began hearing that the risk of addiction was exceptionally low, and that the compassionate way to treat just about any complaint of pain was with an opioid. And we didn't just hear these messages directly from Purdue Pharma, or we would have been less gullible. We were hearing these messages from professional societies, from hospitals, from the Federation of State Medical Boards, from every direction we were hearing that if you're an enlightened physician, you're going to be different from those stingy, puritanical doctors of the past who were allowing patients to suffer needlessly. You'll understand that opioids are a gift from Mother Nature and should be used much more for just about any complaint of pain. All of the individuals and organizations that were promoting these messages had financial relationships with Purdue Pharma. And from the beginning of the epidemic, when the first reports were coming out of New England about OxyContin addiction and overdose deaths, when the problem began to enter the radar of policymakers and the press was just beginning to report about this, the way that Purdue Pharma and other opioid manufacturers and their key opinion leaders and the organizations they were giving money to, the way in which they framed this problem was as if all of the harms were limited to so-called abusers and that millions of people with chronic pain were benefiting from long-term use of opioids. That was not true. The harms were never limited to so-called abusers. Millions of patients who were prescribed opioids and took them as directed have become addicted. Thousands of individuals who became addicted have lost their lives. Opioids are not safe and effective for long-term use for the vast majority of patients with chronic pain. The litigation today holding Purdue Pharma accountable for the disaster that they created is important, very important, not simply for justice for the many victims, for the thousands or millions of families who've been affected by their actions. It's also important because Massachusetts has a very expensive problem to deal with, a problem we will be dealing with for decades. The human and economic costs of this crisis are enormous, and it makes sense to look to the corporation that led this effort for the money to help pay to clean up the mess that they created. This litigation is also important because Purdue Pharma and other opioid manufacturers are continuing to interfere with efforts to promote more cautious prescribing through front groups that they fund. And it's extremely important to send a message to other pharmaceutical companies so that we don't wind up recreating this situation in the future to serve as a deterrence. So I commend General Healey for launching this litigation. Thank you.
Thank you very much, Dr. Kolodny, for that. At this time, we'd be happy to take some questions.
Are there any other states that signed on to this?
Well, you know, there have been some states who filed already, as well as some cities and counties around the country. We're in the process now of also simultaneously participating in a multi-state settlement discussions and negotiations with all of the manufacturers and distributors that are currently under investigation by our office and other offices. So that work will continue, but today's filing is important. We filed in state court right here in Massachusetts. We named the company, we named executives, we named board members, and we're going to continue to pursue this, do our homework as we always do, and see this through in the courtroom.
But why just Purdue? Does this suggest that you weren't able to settle with them and you're still in settlement talks with other companies?
Well, Martha, you know, our investigation against the other manufacturers and distributors continues. As many know, we're also investigating Endo, Janssen, Teva, Allergan, Amerisource, Bergen, Cardinal Health, and McKesson. Those are active and ongoing investigations. They will continue. We brought suit today because we felt like we were at a point in our investigation where it was appropriate. We've been investigating this for close to 3 years now, received and reviewed considerable documents and information, and put together a really terrific complaint, a powerful complaint. For those of you who have an opportunity to read it, it's long, it's 80 pages. But in there, we recount in full detail the actions that Dr. Kolodny speaks to in terms of the coordinated scheme and effort by this multi-billion-dollar corporation to basically exploit and make a profit on the backs of victims. I don't know what will happen with respect to ongoing investigations, but we'll do what we always do. And if we feel we reach the point where it's appropriate to sue, we will. And we're going to continue that work. But today is about Purdue. And Purdue has been really at the lead in terms of bearing significant responsibility for this crisis. But certainly our investigations are not limited to Purdue.
Purdue says that you're sort of suing them by saying that they acted improperly by communicating with prescribers about scientific and medical information that the FDA had expressly considered and continues to approve. And they're saying that you shouldn't substitute your judgment for the judgment of federal regulators who took a long time to look into the dangers or the good things about opioids.
Well, Josh, we'll welcome whatever arguments they will choose to advance in court. I'll tell you this, it's pretty basic, and I think the public knows. You know, we've got a consumer protection law here in the state, 93A, that says you can't lie, you can't mislead the public. Here, what our detailed complaint recounts is that time after time, in doctor visit after doctor visit, and there were thousands of doctor visits made to hundreds of doctors around the state, there were misrepresentations, there were lies about the efficacy, about the safety, about the supposed non-addictive nature of their product. And so we're going to pursue that under our 93A Consumer Protection Statute. But, you know, I'm sure they're interested in characterizing their actions in a light most favorable to them. That's what we would expect any corporate defendant to do. But we've done our homework, and I think we've made the case, and we'll certainly make the case as we go forward in court.
AG Healy, does this clash or dovetail with federal policies, particularly initiatives out of DOJ? Frankly, the drug policies out of DOJ seem to be at variance in some ways. I'm wondering if you can tell me how this conforms or clashes with those policies.
Well, it's an interesting question, and you know, I want to be clear. We've got our job here as a state and a state AG's office to enforce state laws. That's why, you know, what the FDA does or doesn't do doesn't diminish or undermine what our state consumer protection laws stand for, what laws here in Massachusetts say, and how courts have interpreted laws around public harm and nuisance and negligence, which are also counts alleged in our complaint. But I'll tell you, we continue to look for federal partners who will provide the resources for law enforcement, for treatment, to support Medicaid, to support the kind of infrastructure that we need in our healthcare system right now to deal with and to help so many families who are addicted. And we're going to continue to be an advocate to the delegation and to the federal government on these issues.
Can you clarify about the 670 victims? Were those folks who died of overdoses of Purdue drugs or died of overdoses and at one point were receiving prescriptions from Purdue?
You know, those individuals in particular are individuals that we have identified who specifically were prescribed and received Purdue opioids and then died. You'll see, and we'll learn through this litigation, that some died shortly thereafter, even on the same day as receiving these Purdue opioids. Look, we've got thousands, and you know, we're up to over 11,000, nearly 12,000. That probably doesn't reflect the scope and the actual toll, the number of deaths throughout the state as a result of opioids, and it certainly doesn't begin to reflect the tens of thousands of families who are currently with loved ones who are suffering in the throes of opioid-related addiction. But the 670 is very specific because and important for this reason. For a long time, we've heard another argument from Purdue, which is that not on our watch, you know, this is not our bad. We're out there as a pharmaceutical company making available medication for patients, and we're not the ones actually bearing responsibility for or contributing to the harm or the death of people. And what this data actually shows is that, in fact, Purdue, even after you signed a consent judgment with states and the U.S. Department of Justice, even after you entered into a corporate integrity agreement in 2007 saying that you were going to pay attention and to watch these things, even after you started receiving countless reports from the field about what was happening around prescribing, what was happening around addiction, what was happening around opioid-related overdoses and deaths, you went ahead and engaged in a full-out effort to make sure that people were coming into doctors' offices working for Purdue Pharma here in this state in an effort to try to sell as many drugs and get doctors to prescribe as many Purdue opioids as possible, without any regard for the toll that it was exacting on individuals, their families, and now the broader community. And that's what the story of this complaint lays bare in pretty stark detail. Obviously, our investigation is ongoing, and we expect that we'll learn more as we move forward.
What are you asking for, and how did you justify it?
Well, what we're asking for is findings of liability under 3 claims. The first is a claim that Purdue and its executives and board members violated our consumer protection statute. The second is that the defendants created a public nuisance of addiction, creating harm to the public and death significantly interfered with public health in our communities. And the third count is a count of negligence, alleging that Purdue failed to exercise a duty of care to patients, prescribers, and to the state. What we're asking for is monetary relief to account for and to pay for the harm that they caused. That would include, of course, things like penalties, but also damages to account for the harms that they've caused, and change in practices. You know, bottom line is we need to do all that we can to try to bring about accountability, to get to answers, to try to do our best to stand up for these families who have been so terribly victimized and have suffered such heartache through the actions of a corporation that helped create this crisis. But we also need to make sure, Martha, that this never happens again, and that this company and any other companies out there are taking the steps, the responsible steps, to ensure that they're not out there pumping products into our communities that are wreaking havoc, that are ruining lives, and harming our communities, state, and our country.
General, do you see a parallel here at all in the approach that some attorneys general took towards suing the tobacco industry in the 90s and hopefully similar outcomes?
Well, I'll tell you, it is an example where there has been bipartisan work and support, AGs across the aisle working together on these multi-state investigations of opioid manufacturers and distributors. Nearly all states are engaged in this effort at this point, and that is similar to the efforts undertaken by state AGs with regard to the tobacco industry. Look, our job as state AGs is to make sure that we're out there enforcing the laws that are on the books to protect public health, to protect public safety, to save lives. This is an example of that, an example of good cooperation and work together. I make no predictions as to outcomes. I will tell you, though, that our job is to make sure that we have the accountability in the courtroom for this corporation and its individual actors, and that we get the relief that we're seeking. Again, damages to make them pay for the harm that they caused, and changes in practices to ensure that this kind of harm never happens again.
What's the
Last
dollar
question on
figure
this
you're
topic?
putting on those damages?
How do you put a price on a life?
So you're not asking for any specific dollar amount?
We'll work that through in court in proper course. But to be honest with you, the toll, is hard to fathom. If you spend time with and you talk to any of these folks, it's hard to even come up with a figure. You can't come up with a figure that captures the damage done. But it's our job to do whatever we can within the bounds of the law, whatever the law will allow in terms of damages and monetary recovery, to get all that we can for the sake of these families, for the sake of our first responders, for the sake of those little kids who are over in hospitals today, born opioid addicted, for the sake of all those who are out there now as grandparents raising grandchildren. We'll do the very best that we can, and we'll see that through in court. And again, I want to commend my team, your team, Sandy, Jillian, and Eric, and others in my office who worked incredibly hard to put together what I think is the most comprehensive complaint that's been filed to date in this country with respect to Purdue Pharma and its executives.
So you didn't calculate Medicaid, criminal justice, and stuff so far?
At this stage, there's no need to. We've made the allegations. Certainly, those are harms. Those are very real harms. The list is long in terms of harms and damages that have been incurred by any number of entities across the state, our communities, the state, the families. So all of that will be covered through the course of the litigation. But obviously the numbers are incredibly high, but it's more than about the numbers. This is more than about the money. For Purdue, it was all about the money. For Purdue, it was all about the money, and it was profits over people. For us, it's about justice, and it's about accountability, and it's about making sure that folks know, and that no corporation is too big to be held accountable, and that ultimately there's a price to pay for this kind of exploitation and truly egregious action that has wreaked such havoc. You all in the media know you've covered these stories for years now about the devastation, so I don't need to recount that here. But our job as lawyers and as your lawyers is to make sure that we go out, pursue this aggressively as we will, and bring the accountability that we need on behalf of families across the state.
Thank you.
Thank you very much for your time.
Thank you, General.
Thank you.